All right, so hello everyone, and it's my pleasure to welcome you today to our webinar, which has been organized by Center for Health Equity in Zimbabwe. We're going to be speaking on climate change and talking about climate change as the biggest global health threat of our times. And this is a call to advocacy for involvement of all healthcare workers. So we're pleased to have you in the space today and you taking part in this webinar and being present today. I'm going to take us through some house rules for us to observe in our space today. In order for us to be considerate, I will ask that everyone attending be on mute as the sessions are running, as the presenters are presenting. If you're not speaking, kindly make sure that you are muted. And I will also ask that if you have any questions or comments during the presentations, please feel free to use the chat box. Let's be as interactive as we can. We'll refer to and come back to during our question and answer segment. And then we will have a designated time for questions. So yeah, just feel free to make those questions in the chat box. And then also during the discussions, if you would like to speak during the open conversation times, you can just indicate by raising your hand, and then I will call you out, and then you can proceed to unmute your mic and then make your submission. And then I will ask that we all speak, our comments and our discussions be respectful to everyone and each one of us on the platform this afternoon and morning, depending where you're evening, depending where you're calling in from today. And if possibly you're able to switch on your camera, please kindly do so when you're speaking so that we can see you and connect better with you today. Again, it's a very warm welcome. I'm happy to be here moderating this session. My name is Nyasha Grace, as previously mentioned. I'm just going to walk us through what our objectives for this session will be. We want to be able to give an overview of the impact of climate change on health. We also want to discuss why the involvement of health professionals is urgent and is essential. We want to suggest actions for climate change, mitigation, adaptation, and resilience, as well as discuss the importance of the planetary health approach. And finally, we also want to make sure that we make suggestions, suggested structure of our conversation in terms of the way forward and any actionables that we are able to put together from this discussion. So without much further delay, allow me to start off by giving an introduction of our first panel speaker today. Our speaker is Renzo, and I'm going to just read a bit of him about Renzo, a bit of his bio. So Renzo Guinto is one of the world's pioneers in the new discipline of planetary health and a leading advocate for the decolonization of global health. He is the Associate Professor of the Practice of Global Public Health and Inaugural Director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines. Recently, Renzo was also the Chief Planetary Health Scientist and co-founder of the Sunway Centre for Planetary Health in Kuala Lumpur, that's Malaysia. Renzo is a member of the National Panel of Technical Experts of the Climate Change Commission of the Philippines, and he's the convener of Planetary Health Philippines, which is a community of Filipino scholars and practitioners for advancing the new discipline of planetary health. He's an Obama Foundation Asia Pacific leader and an Aspen Institute New Voices Fellow. Renzo has served as consultant for various organizations, including the World Health Organization, the World Bank, USAID, Wellcome Trust, and Health Care Without Harm. And he has been a member of numerous international committees and advisory and editorial boards and professional networks, including the editorial advisory board of the Lancet Planetary Health, and 5 Lancet commissions, such as the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health, which is with Georgetown University, and the Lancet Planetary Health Commission on Sustainable Healthcare with Yale University and University of British Columbia. Renzo obtained his doctorate, Doctor of Medicine, from the University of the Philippines in Manila. And he received further training from Oxford, Copenhagen, Western Cape and East-West Centre in Hawaii. He published more than 150 reports and articles in scientific journals, in books and popular media, and directed and produced short films that communicates the message of planetary healing to the world. In 2020, he was included by the Tatler magazine in its Gentile list of 400 leaders of tomorrow who are shaping Asia's future. In 2022, Renzo was named one of the outstanding young men of the Philippines for his contribution to health and medicine and for pioneering the field of planetary health in the country. So we're so honored and so privileged to have you, Renzo, and your vast experience speaking to us today. I'm just going to introduce your topic and then ask you to take it away. Renzo is going to be speaking to us, and his talk is going to be about how climate change impacts the health of people in his country, which is the Philippines, and how they are currently addressing these challenges of climate change, and how they're building the field of planetary health in Philippines. Renzo, thank you for being with us, and please take it away.
Thank you very much, Nyasha, for that very generous introduction. I didn't expect that you will be reading my LinkedIn profile, but I'm really, really grateful for this opportunity. You mentioned that I've been working in this space around the decolonization of global health. And I always believe that in this day and age, we should be working in solidarity, having these South-South collaborations and conversations. And so when I received this invitation from the Center for Health Equity in Zimbabwe, I didn't think twice to be part of this, I would describe as an Afro-Asian form of solidarity. And I hope that this will just be the beginning of more collaborations between our two parts of the world. And you might have already gleaned from the introduction a while ago, I've been working in this space of climate and health, planetary health for more than a decade now. And it's not just merely out of curiosity or interest. I live in a country that is at the heart of the climate crisis. The Philippines is oftentimes ranked as one of the top 10 most climate vulnerable countries in the world, if you look the annual reports of the German Watch. And, because this is not an issue for us tomorrow or in the future, it's already an issue we're facing now. I believe that it is imperative, especially for the health sector, especially for health professionals, to embrace the climate crisis as part of our own business, as part of our healing mission. And that is, I think, what really animates my work here in the Philippines and also in Southeast Asia, trying to educate fellow health professionals about the linkages between climate and health, between the health of our people and also the health of our planet. We know that climate change is going to impact health in many different ways. In fact, there's no single disease group that is going to be immune to the climate crisis. Name the health problem, name the disease category, and each of them will be affected in one way or another. Of course, vector-borne diseases, infectious diseases, dengue, malaria, tropical diseases that are present in both Asia and Africa. The rising non-communicable diseases, for sure, is also being influenced by the climate. Air pollution causing asthma exacerbations and heart attacks. Heat-related illness, especially when heat waves do happen. And also nutritional problems. Undernutrition is expected to be exacerbated as food insecurity grows due to crop failures, again resulting from extreme weather events like typhoons or droughts. And there's also growing evidence that the health of our brains and hearts is also being affected by climate change. There was a very recent 10-country cross-sectional study that revealed that the young people of the Philippines are the most climate anxious in the world. And that is because the Filipino young people are already not just witnessing, but experiencing firsthand the myriad effects of climate change on their health and well-being. And forced displacement is also anticipated in many parts of the world. For instance, the Philippines has more than 7,000 islands. And these islands, the coastline surrounding our country, are now experiencing rapid sea level rise, some of the fastest rates in the world, and that can eventually lead to massive forced displacement of entire populations. So these are just some of the many different health impacts of climate change. And I'm pretty sure that in Zimbabwe and in the African continent, you may be already experiencing, you are already experiencing many of these effects. And we need to brace ourselves for those effects that are yet to come, because the effects will be pressing or posing an additional burden to already overburdened health systems, especially in low and middle income countries. And so what can we do as a health sector? And I already alluded to equipping ourselves, educating ourselves. We need to make sure that climate and health and planetary health are not just add-ons in the curriculum. They have to be part of the medical education's DNA, or the health profession education in general. Our nurses, our midwives, our pharmacists, everyone should be educated in climate and health and planetary health. Of course, we need to do more beyond education. We need to make sure that our health sector is the last sector standing when all these climate-related impacts, the shocks and stresses do occur. We have to make sure our hospitals are disaster-proof. Our health systems can address many different kinds of climate-sensitive diseases. And for sure, the COVID-19 pandemic is providing us with lessons, and I hope that we are actually learning those lessons and incorporating these lessons into our preparedness and resilience building in preparation for the worst effects of the climate crisis. And we also need to make sure that the health sector is not part of the climate crime. We are not an accomplice to the crime. We are not emitting too much carbon into the atmosphere. And that is also why it's important for the health sector to walk the talk, to green itself, to embrace climate low carbon technologies. For example, when it comes to energy, when it comes to pharmaceuticals, we need to be purchasing our medicines from pharmaceutical companies that abide by environmental sustainability principles. And we also need to make sure that all aspects of healthcare are not harming the planet. And there's so many ways by which we can do it. And later on during the conversation, we can discuss some specifics. And finally, and I understand that this is just an opening intervention, I am really looking forward to our dynamic conversation. This is where the concept of planetary health is very much important, needed now more than ever. And a while ago, it was mentioned that we've established not just one, but 2 centers for planetary health in Asia. We are also hoping to build more in the coming years. And I hope that it is something that our comrades in Africa, particularly in Zimbabwe, will also consider creating, building this domestic capacity for planetary health research, education, and action. Planetary health recognizes that the health of people and the health of the planet are inextricably intertwined, and in fact, they're inseparable. So we cannot be adopting siloed approaches to addressing some of our seemingly insurmountable challenges: climate and health, pandemics or zoonosis, the impacts of biodiversity loss on human health, on food security, among others, different kinds of pollution to the air, water, and land. And I believe that the planetary health framework or approach is really the best way forward. This may sound new to you, but we need to remember, even the father of Western medicine, Hippocrates, once said that medical students and health professionals should be studying the winds, the seasons, the quality of water, because all of these are important determinants of health. And I believe that this is the era where our healing mission should not only focus on healing patients, the human patients, but also the planetary patient that is in dire need of our health, and care and concern. So I'll stop there. And again, thank you very much. And later on, I look forward to our conversation.
Awesome. Thank you so much, Renzo, for those opening remarks. And I'm going to move on to our second with Nightingale Wakigera, who unfortunately is not not present live on the session. She has been very generous to send us. I will ask Tinashe to play shortly. But before we get to that, I just wanted to make a correction. So our webinar is in partnership of the Center for Health Equity Zimbabwe, along with the African Community of Planetary Partners of Health and Environment, a COPE. So just a bit of a correction on that. And if you'll go to your chat box, please find for Health Equity Zimbabwe, engage with us and hashtag the conversation as it's happening now. So to introduce Nightingale, I'll read some of her bio. And Nightingale is a nurse originating from Kenya who is currently pursuing a One Health master's degree. She's a leader of the Africa Community of Planetary Partners for Health and Environment organization, and the child health is Planetary Health, CHIP project, Shiwoki and Sustainable Africa for All. Nightingale Wagera is a registered nurse, mother, and One Health graduate student at the University of Glasgow. Nightingale is a president of Africa Community of Planetary Partners for Health and Environment, COPE, which is an African-led organization that came together for the common purpose of achieving a healthy and sustainable planet for all. Nightingale co-leads Child Health, CHIP, a project that works with and for children to collaboratively connect care for children with care for the earth. As a result, a big part of her work is in advocating for and involving children and youth in conversations and work surrounding the connection between human health and planetary health. She is a strong proponent of involving children from a very early age in environmental stewardship and making clear connections between how our earth as humans is connected to the health of our environment. Together with her teammates and partners, Nightingale reviews and showcases the role of Africa in developing transformative solutions to universal planetary challenges, such as climate resilient communities and sustainable food systems, as well as integrated approaches to agriculture and development. Nightingale is also closely involved in local and global discussions about the role that clinicians can and should play in reconnecting human health with environmental health and planetary health through healthy and balanced relationships. So for this conversation, her submission is she's going to be speaking on planetary health in the African context and what Africa has to offer globally in these conversations. She's going to be talking about co-creating equitable and community-centered solutions that blend art and science to achieve both intergenerational and interspecies justice. She will touch on her experience as an African mother, as well as a healthcare worker. I'll ask Tinashe that she proceeds to play her video. Thank you.
Sure, thank you. And please confirm in the chat if you'll be hearing that sound. Thank you.
To be in this space with you all. And I do want to start by a disclaimer that I'm doing this presentation from an airport, so there might be some background noises, which I apologize about. But once again, really, really glad to be here in this space with great minds and people who do care about our present and our future. I will be presenting as an African, as a nurse, as well as a mother. Much gratitude to the team that has put this event together. Thank you, Tinashe, a colleague and a special brethren that I have worked together with. So my goals really, or my goal is looking at bringing planetary health home to Africa, where I was born and raised. And my very personal inspiration to why I engage in this conversation is two children that I've been fortunate to raise that call me mother. And that is Fathili, who's 11, and Rehema, who's 8. thinking about them, and by extension, our children, our African children, but also our global children, because they're all in this with us. We're all in this with them together. So that's my inspiration. I want to touch a little bit on my impressions from the last year's African COP that was held in Egypt. And COP stands for United Nations. Basically, it's a United Nations Climate Change Conference. And just say that it was a beautiful thing to have COP be held in Africa, because it created space and a place and brought it closer to home for a lot of Africans to attend, in which case had it been elsewhere, they would not have been able to attend. But I also thought about the many people that were missing at that table. And it also led me to think deeper about the importance of building coalitions and networks with a purpose, bringing in conversations about justice and equity, and truly bringing those who have been affected the most to this conversation. As you see, there's a picture of a bird. We call that bird Hummer, or our children call that bird Hummer. And they sent us with that bird so that we would remember the reason why we went to COP. It was for them. It was to represent them as little children, and also the most marginalized. And so it's these conversations that we must think about, these people who cannot speak for themselves sometimes, that we must think about, and also remember to think about how we can bring them or make space for them in these conversations. So from a nursing perspective, looking at climate change and the effects that it had on our lives as humans, I just think about the importance of ensuring that there's proper training, because there are many different changes that even the healthcare practitioners are yet to learn, that are learning at this point. Climate change is a phenomenon that is challenging many great minds also. And so it's very important to ensure that there's the training, practice, and systems coming together at an interdisciplinary level and thinking about collaboration. And this is where I really appreciate the conversations brought forth by Planetary Health and even One Health, and looking at just how core these conversations are and how we must work together. So it is thinking about the importance of contextualizing, translating, and grounding these concepts in the African principles, the African understanding, and the African worldview. It is also so important to remember that because we're not talking just about the world and the effects that climate change has on us, the adults, we must remember that this is an intergenerational conversation, and we must have intergenerational solutions to these climate challenges. And what that means is we must have everybody at this table, both young all the way to old, and also remembering that the old wisdom, indigenous wisdom, traditional knowledge has been there, and that is how the people that came before us had been able to live in harmony with the earth, with our planet, with the animals, with the environment. This is what we must remember, and we must do our best to rescue, to revive, and to restore this knowledge for ourselves, but most especially for our children and future generations. So again, centering our youth. This is a beautiful picture of those two children that I talked about earlier. And they always help me remember to center them, both verbally. They will come and remind me but and also just remembering in my mind that it's for them that we're doing this for the most part, and remembering to have them as part of the conversation is so important. They have so much to share, but it's also their future we're talking about. So how can we have conversations about someone and not have them at the center of that conversation? So a copy is rounded in African roots. It's just wanting to share that wisdom that has been there for ages. So a coffee in general, which I'm president of, stands for Africa Community of Planetary Partners for Health and Environment. And so again, thinking about centering our communities as we talk about our health and how it's connected to the environment. So the potential next steps that I see is finding ways that we can partner in these discussions as we all would agree. And so one invitation that I would like to make is about Earth Day that's coming up very soon. It's going to be on the 22nd of April. And this is where, as a coffee, we're looking at connecting communities for children and climate. That is going to be our agenda, and the children that will be leading this conversation are children at secondary school, female secondary school, and they will lead the communities to work on environmental stewardship, planting trees and cleaning the environment, and also offering conversations and learnings about our environment or conservation. And then there's also another conference that's coming up that will be in Mombasa, Kenya. And this is collaboration between the Kenya Pediatric Association and the International Society of Social Pediatrics. And this is basically another conversation about children, bringing the advocates for children and how to approach the climate change question, but also bringing in the children as well to be part of this conversation, children and youth. And so if you want to know more about this, please do feel free to reach out to me or to the Coffee community on this email address, wakigera@gmail.com, as well as coffee@gmail.com, and we can talk more about how we can partner. But most of all, I am very thankful to be a part of this conversation, looking forward to learning from you all, and looking forward to continuing this conversation. Thank you.
Thank you very much, Nightingale, for that presentation and just deepening our awareness and to remember our children and all of this work. So with that, we're going to move on to the next part of our webinar, which is a presentation from our final speaker for today, our panelist, and I will introduce our final speaker, that is Sunanda Ray. Sunanda is an emeritus professor who's currently attached to the Department of Medical Education, Faculty of Medicine at the University of Botswana. She previously was a professor for Community Medicine College of Health Sciences at the University of, as a public health physician in Botswana, Zimbabwe, and Britain. Her research and activism has covered sexual and reproductive health, health systems, strengthening and health professions, education. She is an assistant editor for the African Journal of PHS and Family Medicine. She has published special reports on climate change and health. And today we have the honor and the privilege of hearing from Sananda, who's going to be speaking to us about the advice that she would like to give young people who want to advance climate justice in their own lives and at work. She's going to be speaking to us using the example of the HIV experience of the 80s and saying that we should not wait for government for action, but we need to start mobilizing in groups with advocacy and education, and also going to be highlighting the importance of collecting stories and data in all of this work. So Sananda, we're happy to have you here today. Kindly go forward and give us your talk today.
Okay, thank you very much. And thank you, Tinashe and the Center for Health Equity for inviting me to join you today. So as Nyasha has said, I wanted to just give you the experience that we had of the HIV pandemic. So I was in Zimbabwe when HIV started. So this was we began to see cases in the middle of the 80s. And the reason why I make that comparison is because there were several of us who were involved in reproductive health who felt very frustrated because we could see that this was going to be a major problem for the health sector and also for communities. And yet we were in the middle of a lot of secrecy, a lot of denial. And worst of all was that as a public health physician, we were using health information to show that this was an emerging problem, but people were accusing us of being alarmist. So I just wanted to bring that as an example because I feel like we're in a similar situation now. And people will either feel paralyzed that there's nothing that they can do, or they will think, they will believe what the denialists are saying. And then the governments are always slow to act. They're the laggards in emergencies and crises. And they also often wait until they've got money coming in from donors before they do anything. So it's up to us as advocates, as activists, as community leaders, to start pushing the boats out so that people take notice of this. And then along the way, the governments will also begin to act. Quite often people send delegates to the COP meetings and to other international meetings, and they make lots of promises. But I think that in Africa, we're seeing that there's not very much happening on the ground. So I wanted to give you an idea of the kinds of things that are happening, but also to suggest how we can ramp it up, how we can mobilize faster with our community skills to try and make a difference. So I wanted to refer to an American activist called Naomi Klein, who has been speaking about climate change for a long time. And she was saying that what the problem is that people become dispirited or they become demotivated when they feel like they're acting on their own. So one of the key things that people need to do is exactly what our earlier two speakers are demonstrating, which is that you need to find a movement to join. It can be a small group of people or it can be a large group of people, but whatever it is, find a movement and start working with them on the ideas that you have or that you and your friends have. Because working on your own, and this is where the HIV situation is exactly a parallel, because so long as you're trying to combat this on your own, it's very dispiriting. But as soon as you begin to get connected with other people and you inspire each other, then that is the way that things take off. And with HIV, it was when the activists, people in communities, when they started speaking out and trying to hold the governments accountable, that things really made a difference, including in getting access to antiretrovirals. So what Naomi Klein says is that the benefit of being part of a broader movement is knowing that some people are doing some things and other people are doing other things, but nobody has to do everything. So each person plays a part, or each group plays a part. whatever you do, find a way to connect it with climate change. This was another parallel with HIV, which is the concept of mainstreaming. So we had to work out how all the activities that we were involved with, we had to somehow bring HIV into it. So people were working on sexual and reproductive health rights, then we would discuss with them how they could introduce HIV as part of sexual and reproductive health. If people were working on access to healthcare or health as a human right, we would bring HIV in so that it was mainstream through all the programs. Because otherwise what happens is you have people who are specialists or people whose entire work is based around, in this case, around climate change or planetary health. And everybody else kind of stands with their back to the wall and lets them get on with it. Now things will not change that way. And it puts a huge burden on the activists who are trying to deal with this. So it's really important that we support each other in trying to address these issues. And everybody can play a part. Now, if you look at the information on the internet, we didn't have the internet in the 80s when we were trying to do the HIV work. But if you look at what's happening now, is there's stacks of information. There are stacks of resources. You can get a 5-minute video clip or you can listen to a podcast for an hour and a half. So people need to get informed and you find the information for your particular interest and then find out how you can use it to act, okay, with other people. As I said, don't wait for governments, but use the information that you have to influence governments. So whenever you go to a meeting or you go to, even going to your clinic, you could say, what are you doing about climate change? So some of the things that are happening already, I think we heard earlier about including climate change in training of health professionals or health workers and in the curricula. So there are people who are working on that. In family medicine in particular, they're developing modules on climate change to put them in so that people are studying it. But quite often people learn these things from a theoretical basis. They don't learn them as activists. And I think that's what we need to do, is really take this on as an advocacy and an activism issue. And we could see that young people all over the world have actually been at the forefront. And I loved what Nightingale said about really focusing in on children, because they're the ones who are going to be bearing the brunt of climate change, and it's our responsibility to look after them. So we'll put links on the Facebook page. There's a lot of material on the particular issue about health systems. Excuse me. On that particular area, people need to know that health systems themselves generate greenhouse gases for climate change. How do they do that? Quite often people are like, what does that mean? Is it something that's really obscure, like anesthetic gases? There are particular gases which are used for anesthesia, which actually go into the environment and impact on climate change. And in many high-income countries, they've actually now been banned. Is it as remote as that? No, it isn't, because if you look at everything to do with health systems, the pharmaceuticals that we use, the materials that we use, all of them are produced, they're used, and then they're discarded. So if you look at clinical waste, if you look at the energy that's used in health facilities, if you look at the materials that are used, all of these consume energy, or they require fossil fuels to create them, and then actually to dispose of them also uses energy. So it's been calculated that health services contribute 5% to the global greenhouse gases. So we can all look at ways of how we can reduce that. And there are sites like the Center for Sustainable Healthcare, which is a link I've put on the Facebook page. We can look at that site. They've got lots of courses and access to links where we can get ideas. So my point that I wanted to put across is that there's no shortage of ideas. There's no shortage of information. What we're short of, what the big gap is people translating those ideas into action. And we need to get together and mobilize for that in whatever way we can. Okay, I'll stop there. Thanks.
Thank you very much, Sananda, for that submission. And with that, I'm going to take us into a section for a conversation, a discussion. I think we can just bundle up our question and answer segment with the discussion segment. Looking at my time, we have 18 minutes, 17 minutes to the top of the hour. And so if we can use the next 15 minutes for an open discussion, and then Tinashe will come and give us the next steps after this conversation. So anyone who would like to open our segment, kindly raise your hand, and then I will ask you to make your submission. Anyone got a comment, got any reaction, any questions? Let us have a conversation. Okay, I think while people are figuring out their questions and their comments, I do have a question here that was submitted on our registration forms. And the first one is, someone says, I'm a distributor of organic fertilizers and very much interested to hear more about how climate change is affecting our health as the agricultural sector, and the overuse of fertilizers and chemicals is obviously a big contributor. Renzo, can I ask you to take this one? Let us know how climate change is affecting our health in the agricultural sector.
Sure. Thank you very much for that very important question. And I, this is also an encouragement for us to make sure that our nutritionists are also included in this conversation. When we say health professionals, that should also include the nutritionists. And we know that the food system is very much interlinked with the climate crisis. On one hand, the defective food system that we have, the dysfunctional agricultural production systems that are operating at the moment are also contributing to the climate crisis due to its enormous amounts of carbon emissions. The food systems are also utilizing a lot of energy and water and land resources, and also, as already mentioned, even chemicals like pesticides and artificial fertilizers. So, the food system is part of the problem. But also, on the other hand, the food system is very much vulnerable as well to the climate crisis. In the Philippines, our farmlands, especially rice production systems, that's our staple crop here, are destroyed by either intense flooding and storms on one hand, or intense heat and drought on the other. And that imperils our ability to feed more than 100 million people spread across our 7,000 islands. And so we need to really act on the food system, not only to make sure that it's not contributing to the climate crisis, but it's also withstanding the effects of climate change, because that will lead to many challenges in our global nutritional status. And then finally, I think this is where the planetary health concept is going to be very useful, because I know and I understand that our focus now is on climate and health. But the planetary health concept reminds us that beyond climate change, there are also other planetary health threats that exist. And you might have heard of the Planetary Boundaries Framework. Unfortunately, 6 out of 9 planetary boundaries have already been violated, such as the boundary for the physical chemical flows of nitrogen and phosphorus, again, as a result of our addiction to artificial fertilizers, or land use change, because we've been turning our rainforests into agricultural lands and human habitations. So planetary health is a very powerful concept that will enable us to address multiple issues at the same time, not just climate change, but all the violations of the planetary boundaries that have huge long-term implications for the health of people and the planet. I'll stop there.
All right, thank you so much, Renzo, for that. I'm seeing a couple of hands have gone up. So Nanda, can I come to you after we get a reaction from Vanessa, and then I will ask you to speak and also answer a question that we have. Vanessa, if you could kindly unmute and give us your submission.
Hello, everybody. Thank you very much for this organization, for this meeting. I'm Vanessa Góes from Brazil. I am a registered dietitian, and I would like to add about what Renzo said to the highlighting the other side. We as individuals, we can contribute changing our lifestyle, and especially our dietary lifestyle, because this is what we can do. We don't depend on anybody else. And if each one of us start rethinking what we buy, how do we eat, what do we eat, where do we buy things, we will make a difference. Besides that, all the disruptions that are happening in the planet are also affecting the quality of our food. So we are losing the nutrition and also our biodiversity, and this is affecting the food security and also sovereignty. I never say this word very well. So we also, besides, I mean, not only thinking about nutrition, but thinking also about culture. I mean, what do we have in our territory? What is grown there? What is our ancestors, our grandmothers, I mean, used to cook? So we need to kind of rethink that to make a difference. I will pass the word. Thank you very much.
Thank you so much, Vanessa, for just bringing more depth into how we need to think about how we're consuming our food. So relevant. Sananda, I'm going to pass on to you. Can I ask that as you make your submission that you also give us a response to our second question, which was how can we integrate climate change into health? So please go ahead.
Oh, okay. I just wanted to, it's just to add on to what Vanessa was saying about making choices about food. So one of the problems has been that people have been very focused on growth. And so growth has been around increasing consumption of everything. And so the huge commercial farming empires that have been built up are around having people consuming more food, but also that food is transported over large distances. So if we think about anything that needs to be transported, so from our point of view, one of the examples is that Pick n Pay in South Africa transports food all over the African continent. So they've got trucks carrying food right up to Uganda and Tanzania and places. That is all destructive to the environment, as well as to the road infrastructure. So one of the choices we can make is to buy local and to support smallholders, particularly in buying vegetables, etc. That's something we can all take on without too much effort. And then the other thing is also with climate change is to think about agricultural workers, because as temperatures go up, the heat stress that people are faced with will affect people working outside the most, and that falls within occupational health. So the study that was done in Gambia, where they showed that pregnant women were actually having their babies earlier, preterm deliveries, and also small for dates, was because these were women who were working outside while they were pregnant, working in the agricultural sector. So not only is agriculture a producer of greenhouse gases, but also the agricultural workers are very vulnerable in the effects of it. The issue about integrating climate change with health is that it goes all the way through. So if you just take an example, people tend to think about extreme weather events like flooding, cyclones, the fires that we've seen in Australia and in California, etc., people think of that as a sign of climate change. Now, when any of those things happen, like if you take right now Cyclone Freddy, so Malawi has lost half of its infrastructure has gone with the floods. 4 or 5 years ago, when in Mozambique, Beira was flattened, you know, as part of that, they lose their health infrastructure. So the people who are working in the health facilities, they may have had a program for developing, you know, non-communicable diseases, managing diabetes and hypertension. But when a flood comes along and bombs out the infrastructure, when things are restored, even if it's built back better, then they're starting from scratch. So it's like people are having to keep renewing themselves because of the dramatic consequences of these extreme weather events. So as well as the fact that they're facing cholera because of the water being contaminated, they also now need more resources to be able to deliver the programs that they were doing before. The whole supply chain gets broken down. So they may not have drugs in their clinics for people who have HIV, for example, for them to get their ART. It's almost like you could take each program and break it down and say, how will the temperature going up by 2 or 3 degrees, how will that affect this community? We know that it affects children and the elderly worse. How will our health service be responsive to that? And that's why I wanted to say that it's really important that we strengthen our primary healthcare system, because they're on the front line working with communities. And not only will they be the ones who are the early responders, but they're also the ones who will be educating people and trying to show people how, you know, the safety issues. And they link up with community leaders, they link up with traditional healers, community health workers. So we have to put more resources into primary healthcare. Right now, it's all sitting in capital cities, in tertiary hospitals. We need to move those resources into building up our primary healthcare systems. Thanks.
Awesome. Thank you so much, Sananda, for that comprehensive response. I see Roger, thank you for your patience. You've got your hand up. Would you kindly unmute and make your comment?
Thank you for this talk. I'm Roger Chiza, as you know. I'm Burundian I'm a Burundian citizen from Africa, from East Africa, but actually I'm studying at the University of Oxford. So I really appreciate this initiative. And my comment is, how can we be able to make our government more involved in advocacy for climate change issues? Because this talk is meant to talk more about public health, which is really okay. But in my understanding, I think we need to go beyond that and make sure that we involve our policymakers, especially African policymakers, to be able to, for them to have their voice heard. Because the big problem is that actually low and middle income countries are not experiencing consequences from climate change, whereas they are the smaller COD emitters. So the big problem will be how to make accountable high income countries, which are more responsible of this what I can call pandemic. So maybe we need to see how we can, like the lady who is lecturing in Botswana, like she said, we need to see how we can organize platforms so that the national movement can be strong to push higher for the advocacy. Thank you.
Thank you very much, Roger, for just putting light on the issue of how governments need to be involved along with this work. And with that, I'm going to go to a question that was answered by Nightingale, which also touches into how government can also be activated. The question is, how can we ensure that efforts to address planetary health in Africa are sustained over the long term? And her responses are, we need to set up organizations at the national level that ground planetary health into the most relevant and compelling issues and stories for that nation state. We also need to aim to partner at regional, continental, and global levels as well. She says we must work closely with government officials to incorporate integrated approaches that seriously consider both health and environment into policies, principles, and practices. She says we must continue sharing ideas and best practices while simultaneously building trust and deepening relationships among friends and allies. We must make planetary health cool, fun, exciting, and partner with children and youth to mainstream planetary health, aiming for it to go viral, but in a healthy and balanced manner. And finally, she says we must ensure that planetary health activities and events are child and family friendly, and they're inclusive and welcoming and accessible, instead of expensive, elitist, exclusive, and overly technical academic. All right, okay, and with that, we're exactly 2 minutes away from the top of our hour. I will ask that we move on to our last item on our agenda, and that is Dr. Tinashe to just tell us what our next steps will be.
Thank you so much thank you so much, Nyasha, for moderating this conversation, and thank you to the panelists Nightingale, Renzo, and Sunanda. And I'm really excited, especially when Renzo mentioned that the importance of South-to-South collaborations. And thank you to everyone who came through. It ended up being a global conversation. It was great to hear from Brazil, Burundi, and we really hope to continue having these conversations. And I think people can agree that this is much needed conversation, and there's a lot of work that is being done. And it's always amazing when we get opportunities to learn from or work already going, so that we do not reinvent the wheel. So I think some of the key next steps that we were hoping for this platform is, this is not only the start of this is not the only conversation we're going to have, but we'll continue to have more conversations with different partners, doing different working on planetary health, working on climate change and health, so that we amplify the work that they are doing. And not only that, we also raise awareness and we also learn from them, so that in our respective countries we can start having different initiatives or be part of or support already going movements. And I think one of the immediate things, the next step for this one is we will be having a journal club. We're planning to have it the last month of Thursday, where we'll be discussing some of the articles, and our partners at Coffee already also have a journal club with some information about how to join them. And I think we'll engage them on partnering on this journal club, so that we really, I think a lot of people would want to understand more. There are a lot of scientific papers that are being published that were quoted, and there are a lot of, right now, recently there was the IPCC report, and I think it would be great to be up to date with the developments and discussions ongoing to help and inform our work. So the idea is for the journal club will be a space for all of us to maybe commit to maybe discuss a paper together, so that we all learn and understand better, so that we can also be able to respond to the questions better when in our communities people ask us about the importance of this issue. So we invite you to join that, and we'll be sending more information on that. And we will also be sharing the recording for this conversation, and we will send you details on how you can join the Coffee platform. We have also sent Facebook information for the climate change Facebook, and also send information about joining the WhatsApp platform. But the idea is for us to continue having the conversations, not in silos, but to look at how best we can collaborate and build power together for a more sustainable future. Thank you so much.
All right, thank you so much, Tinashe, for those next steps. And thank you all for coming and being a part of this webinar. It is 1 past the hour. Thank you for allowing us to go a little bit over, but that's it from all of us here at Shares and Akope. We look forward to more continued conversations, and we'll be getting in touch on your emails with further details, as Tinashe has mentioned. Enjoy your evening, your day, and goodbye for now.
Thank you, Nyash.
Thank you.